One of the biggest misunderstandings about the PLAB 2 exam is that it is a knowledge exam. It's not. It's a skills-based OSCE. And preparing for it like a knowledge exam is one of the biggest reasons why many doctors score poorly on it. What I'm going to do in this video is try to explain what PLAB 2 is actually assessing and how you can improve your scores. I was involved in clinical practice and medical education in the UK for many years, including OSCE examining. And one of the things that I see most commonly, and I've been helping PLAB students prepare for PLAB examinations for a few years now, are not unsafe doctors or doctors who are incapable of passing the exam, but doctors who don't quite know what examiners are looking for, how to demonstrate their skills, and how to get the scores. And hopefully that is what we'll try to tackle in this video. Most candidates approach PLAB 2 thinking, if I know about the conditions, about the diagnosis, about the guidelines, and how to manage the conditions, that I can pass the exam. However, it's not just about knowing all of these things, it's about being able to demonstrate them in a particular patient scenario and in different situations. The PLAB exam is an OSCE. It's time pressured, it's designed to test certain skills, and it's there for you to demonstrate certain competencies. It's not about knowledge or just knowledge, it's about performing in an exam setting, which, to be honest, is what all exams are about. The exam is also about getting marks for what is seen and heard. It's fine having lots of knowledge, and of course that's useful as well and it's good. But if an examiner doesn't hear that or see that, then you're not going to score the marks. So you need to verbalize things correctly. The PLAB examination is about a few core things, and we'll go through them one by one. Firstly, an examiner is looking for structure. So how do you establish the structure of the consultation? In fact, before that even, PLAB examiner is looking to see, have you understood what the station is about? What is your task? And obviously that work starts at the beginning whilst you are outside the station. And then the examiner is looking for, how do you take control of the situation? Do you have an agenda? Are you able to be structured? Are you able to think clearly and express your thoughts clearly, while at the same time being patient-centered and not taking over the consultation? PLAB 2 examinations or PLAB 2 stations are also about safety. Lots of doctors I see know the right things to do a lot of the time, but they either don't verbalize them or they don't verbalize them correctly, and so they struggle to pick up marks. So it's also about expressing yourself and phrasing things in a way that is patient-friendly, but at the same time tells the examiner what you are exactly thinking. And that brings me on perfectly to communication. Communication is a key part of the PLAB 2 examination. Are you able to listen attentively? Are you able to pick up cues? And are you able to express yourself clearly in the examination? It's not just about what you say, but it's how you say it, especially under pressure. And examiners look for clear thinking, logical sequencing, and clear expressions. What candidates do sometimes when they struggle with PLAB 2 is they think that practicing more will help them and will improve their scores. However, if you are practicing without targeted feedback, particularly from somebody who knows what examiners are looking for or what the mark scheme actually means, then what that will result in is not improvement, but it will just result in frustration, and you will keep building and solidifying the bad habits that unfortunately you've fallen into. So repeated practice without targeted feedback is actually counterproductive. And the point I started with in the beginning was differentiating between skills and knowledge, and that's the difference. So you can have all the knowledge in the world, but if you are unable to express it in the right way and demonstrate that knowledge in a clinical situation, then you're going to struggle with the PLAB 2 exam. Earlier this week, we shared a video of me doing an acute SIMMAN station. In there, you will see, if you watch the video, that the focus is not on knowledge and guidelines, and it's not on perfection. It's on demonstrating the right skills and trying to take charge of the situation safely, to communicate effectively with both the patient and the examiner, trying to be clear, trying to be structured in the way in which I approached the clinical situation, and that is what results in PLAB 2 marks, and that is what increases your chances of passing the PLAB 2 exam. If you're preparing for PLAB 2, it's important to stop thinking about it as a knowledge-based exam and to start preparing for it as a skills-based assessment. In the coming weeks, hopefully, what I'll be trying to do is breaking down examiner expectations and giving advice on how you can prepare for the exam in the correct way, focusing on skills rather than knowledge. For those who are looking for support, we do offer more structured programs. However, changing your mindset about the exam is the first step, and I hope that this video has helped you do that a little bit.